Singapore's real household incomes fall for the first time in over 10 years, with lower income families the hardest hit. Out of more than 280,000 stay-home notices issued last year, 22 people were charged with breaching SHN requirements. And Singapore's first case of likely COVID-19 reinfection raises questions about how long immunity might last and what it means for vaccinations. Happy Monday, it's 5:30 p.m. here in Singapore and we're coming to you live from the Straits Times newsroom. I'm Haryanto Diman. Now you can subscribe to the Straits Times channel so you never miss a single episode. The COVID-19 pandemic and economic recession hit Singaporeans in the pocket last year, with overall median household income falling for the first time in more than 10 years. According to the Department of Statistics, the median monthly household income from work fell by 2.5% in nominal terms from $9,425 in 2019 to $9,189 in 2020. After taking into account inflation, this works out to a 2.4% drop in real terms, the first such decline since the 2009 global financial crisis. Lower income households were the hardest hit, with those in the bottom 10% seeing a 6.1% real decline in income. The impact was mitigated by an increase in government transfers last year, with resident households receiving $6,308 per household member on average. That's compared with the $4,684 received in 2019. Lots to digest here. Let's bring in Associate Professor of Economics Walter Teixeira from the Singapore University of Social Sciences to weigh in on this. Welcome, Professor. Now, Professor, the last time real median monthly household income fell was during the global financial crisis. What do you make of the decline in 2020? How does a 2.4% drop affect families?
Well, first, let me point out that we've had a much larger drop in median income than in average income. So real average income fell by about 1%, median by 2.4%. And what that means is a large part of the effect of COVID-19 has actually been on the lower to middle part of the income distribution. And when you break it down further, you tend to see a larger negative impact among the bottom deciles by household income. Now, in fact, the estimates actually suggest that household income among landed property residents actually rose slightly in 2020. And that reflects the experience in other countries where the impact of COVID-19 has really been very heavy on lower to middle income workers. Many high income workers who've been able to transition to working from home have not been affected that much by COVID-19. And the point really is that it is not as if all households in Singapore have had their income cut by that 2.4%, which is about $236 per month for the median. That's the median effect. But what has really happened is some households have had income earners out of work for months. Others have had to change jobs, maybe to temporary lower paid work. But many others still have had very little or almost no change to their income. And so the impact on households is going to be very uneven. Some are hurt very badly, many others have hardly been affected at all.
Do you expect household income to bounce back, and how quick will the recovery be?
That's a difficult question to answer, but I expect that to be an uneven recovery, a very uneven recovery. And this is based on the early evidence from other countries. Official data is a bit lacking, but there's a good data collection effort in the US on private sector payroll data. What it shows, interestingly, is when you look at the top quartile of income earners in the US, the COVID-19 pandemic is essentially over as far as their incomes are concerned. They've basically bounced back to what their incomes were like before the pandemic. Now, by contrast, lower income workers, especially in services, they have been hit hard by the closings of the economy, especially during now the second and third wave going on in many countries, and by all these disruptions. So I think in Singapore, we're likely to see the same situation, a very uneven recovery. If your job or sector has allowed this smooth transition to remote working, I would say that for many people, things are almost back to normal. And indeed, in some sectors, we've even seen a boost in demand. Digital services to support remote working, consumer essentials, workers in those areas have actually been rewarded for their strong performance. We've seen that in Singapore with a certain supermarket chain. But on the other hand, we have also seen that travel sector, tourism, entertainment, these are depressed and will likely continue to be depressed for quite some time to come. So I think there will be a very uneven recovery in household incomes.
Professor, government transfers through various schemes offered relief to many households, but of course this cannot continue indefinitely. So what else can be done to help households, especially those in the lower income group?
Well, first, I think it's important to distinguish between ongoing transfers have already been in place before COVID-19 and the special measures that we've taken to support households during the COVID-19 crisis. The bulk of the transfers to lower income households are actually ongoing permanent transfers. Many of these, are things like to support work and human capital development. Workfare income supplement, that's one of the larger transfer schemes, and educational subsidies are also counted as transfers. So where I think COVID-19 special transfers made a difference was to help households tide over the circuit breaker, where a lot of people simply couldn't work, and also to support them if they had to change jobs or if they lost jobs because of the COVID-19 crisis, especially in our tourism and travel related sectors. But I think we've seen now that for many workers, the employment situation is actually recovered. Employment levels for residents by the end of last year had actually recovered to the pre-COVID-19 crisis levels. So I think there's less need for that kind of support to households now. What I think is going to be important going forward is to help affected households upgrade their jobs and change their jobs because some of the work that people are vetted into is temporary in nature. Jobs like safe distancing, safe entry management, delivering food and parcels, there's going to be a reduction in demand for many of these activities as the economy recovers, as COVID-19 starts to be managed better. And all these jobs pay the bills, but people are going to want better jobs with better career prospects as the economy recovers. So I think it's going to be very important to try to direct government support towards job creation, towards better job creation, and to help employ Singaporeans in these better jobs as the economy recovers.
Well, thank you so much, Professor, for your valuable insights. Happy to have you on the show. I've been speaking to Associate Professor of Economics, Walter Teixeira, from the Singapore University of Social Sciences. Now, you can read more on the report by the Department of Statistics on straitstimes.com. Also in the news today, more than 100,000 job seekers were hired under the Jobs Growth Incentive in September and October, the first 2 months of the scheme's implementation. The workers were hired by around 26,000 firms, with about half of them aged 40 and above. The Manpower Ministry noted that the top hiring sectors included food services, wholesale trade, professional services, retail and construction. Meanwhile, Trade and Industry Minister Chan Chun Sing said today that the government will support the growth of local manufacturers by helping them build their capacity to innovate and ride the next wave of growth. Speaking during a visit to Sanwa Plastics Woodland Factory, Mr. Chan added that local companies need to look beyond price competitiveness and develop a niche for themselves so as not to be easily displaced in a global supply chain. Various schemes like the Productivity Solutions Grant and Skill Up SG are available to help local SMEs innovate their products and processes and access larger markets beyond Singapore. An update on the COVID-19 situation here. 2 new locally transmitted cases were among the 22 infections reported today. Both cases were in the community and no new infections were reported in foreign workers' dormitories. The remaining 20 were imported and placed on stay-home notice when they arrived here. Separately, 22 people were charged with breaching SHN requirements among the over 280,000 SHNs issued last year. The Immigration and Checkpoints Authority said they included a 34-year-old Singaporean man who breached his 14-day SHN to eat bak kut teh and a former nurse who left her residence to buy bubble tea. Now, over the weekend, Singapore detected its first case of likely COVID-19 reinfection. The patient is a 28-year-old male Bangladeshi national who holds a work permit and resides in a dormitory. Now, identified from rostered monitoring testing by the Health Ministry, he tested positive for the virus on January 25th, but was otherwise asymptomatic. His previous positive result was on April 12th last year, and since then, he consistently tested negative for the infection until now. Let's get an expert's view on this. Joining us is Professor Dale Fisher, Senior Infectious Diseases Consultant from the National University Hospital. Welcome, Prof. Prof, there have been cases of COVID-19 reinfection worldwide, but they're not common. So how can reinfections happen, and what have we learned from these cases overseas?
Thanks, Haryanto. You're quite right. There have been dozens of proven reinfections, but to keep it in perspective, this is dozens in the setting of obviously many millions of cases. So we need to keep it in perspective. It is quite rare. How rare it will remain is not clear, because obviously the first infections are all in the last year. So I think there's a lot to learn about this going forward. The immune system is about the body defending itself against foreign material. So the immune system will attack infections. It'll attack any cells that might be turning into cancer, for instance, or even if you get a splinter, the immune system goes in to fight it. So the immune system is very important. And what we know is probably most people are familiar with antibodies as a key part of the immune system. And it's about in terms of infectious diseases, it's about the body remembering that it's seen that infection before, so that it can fight it with great urgency if that infection comes back. So the body defending itself can mean a couple of things. It can either mean stopping infection altogether. We know a number of diseases that you really only get once, or it can be about making the infection more mild and you even get it. And there's about 4 other coronaviruses that are commonly circulating, known as common colds. So we get exposed to them when we're young, but as we get older, we keep getting common colds. We may get the same coronaviruses, but they get milder as we get older. So it's not lifelong immunity. So in summary, reinfections are really not a game changer. They're just something more we need to learn about how we manage COVID-19.
Right. So that said, Prof, what can we do to prevent reinfections?
Well, it's the same things that everyone's very well familiar with. Stopping droplet spread is the most important, and obviously contact spread through using hand hygiene. But droplet spread is the distancing, the masks, letting yourself be exposed to less people, so no large groups as Singapore is being instructed to, for instance, during Chinese New Year, to just don't expose yourself to so many people. You're less likely to get such an infection. Community behavior is really important. If everyone that gets any symptoms goes and has a test and therefore gets out of the line of fire, if you like, if you're positive, then this also prevents other people getting it. You might remember we used to talk about cough etiquette. This is before COVID, where we'd say, look, cough into your sleeve, or cough into a tissue or something like that. Don't go to work if you're sick. Of course, during COVID, we do things a lot more aggressively now, but these are all the ways to stop and prevent infections, but also obviously vaccine, possibly revaccinating in the future if we find that we need to. There's many ways we've got of supporting our immune system.
Right. I'll be asking you something about the vaccines later on, but there is something else that I want to touch on right now. Now, some countries have considered developing herd immunity in their population as a way to manage their COVID-19 situation. But given that reinfection is possible, is achieving herd immunity still an option, Prof?
Oh yes, herd immunity is the strategy. The only way out of this really is to obtain herd immunity. People shouldn't confuse natural herd immunity, though, with vaccine-associated herd immunity. Herd immunity is where we get enough of the population that have that added advantage, that immunity, to prevent infection or to prevent severe infection. And the strategy of letting natural herd immunity occur was entertained by a few countries early on, but that was always never going to be a good strategy. Just doing the maths, you realize that too many people had to die, too many hospitalizations, too many hospitals had to get overwhelmed to get there using natural herd immunity. So we want to get there by vaccine-associated herd immunity, and that's still the strategy. The vaccine version, of course, is showing a piece of virus or a dead virus, whereas natural immunity is showing the whole virus, where you actually get disease at the same time. So obviously vaccination's better.
And of course, on the topic of vaccination, Prof, it has been reported that some countries are making far more rapid progress than others in their vaccination rollout. Now, Singapore has said its population will likely be vaccinated by end of this year. How will the issue of reinfections affect or even complicate, if any, vaccination rollout? And does this mean the population needs to be vaccinated regularly, like the current flu jabs, which are recommended yearly?
Yeah, we don't know yet. Clearly, we know vaccination is urgent globally to bring about control of transmission. We're not, no one is seriously talking about eradicating COVID. What we want to do is eliminate community transmission. So there'll still be cases and there'll still be little clusters forevermore. But if we can get rid of this tendency for mass transmission, which we've seen in Singapore in the middle of last year, and in fact, in many countries, even still now. So we want to stop that mass transmission, and vaccine will get us there. Yes, there might be a few reinfections, but it won't be large numbers. Will we need more jabs in the future? I think it's quite possible. Especially if the variants, the mutations that are occurring now that we're hearing about from South Africa and Brazil and the UK, if they start to escape the vaccine, then yeah, it's quite likely we might have to have another vaccination, which is a bit tweaked. But that's exactly what we see in the flu vaccine. We recommend that to certain people every 12 months, basically. But each of these vaccines is slightly tweaked based on the latest variants. So that's certainly a possibility going forward.
Right. Well, thank you so much, Prof. Fisher, for setting aside time to speak with me today. That was Senior Infectious Diseases Consultant from the National University Hospital, Professor Dale Fisher. Now, have you ever wondered what your children get up to on social media? Well, in a survey commissioned by the Straits Times, a third of parents say they don't know who their kids interact with on Facebook, Instagram, and YouTube. In the poll of about 600 parents with children between 7 and 16 years old, 8 in 10 said they're concerned about their children using social media, spending too much time on it, and frequently distracted by their phones. When it comes to younger kids, the survey found that 67% of children aged 7 to 9 in Singapore use smartphones every day and are active on social media. 41% of them have their own Facebook accounts, while a quarter are on Instagram. Education correspondent Amelia Teng has more on what the results tell us about parenting in the age of social media.
The experts that I spoke to said that screen time, social media use has become one of the most challenging parts of parenting today. And between parents and children, often social media comes out as a point of tension. And I think if parents just simply curb social media usage, a lot of times the children, especially teenagers, will feel like, you are not really concerned about me as a teenager, and you don't bother to reach deeper to understand why we are using social media, and that's why some of this conflict and this tension comes about. So while the survey showed that parenting control apps and monitoring how much time your kid spends on social media is a form of is a way that parents try to manage social media usage. It should be part of a larger parenting approach that is grounded in certain values or principles that is important to your family. And so when you set these clear expectations and boundaries from the start, when you give your child a smartphone, it's easier to get their buy-in later on when you want to monitor how much time they spend, what platforms they use on social media.
In the global headlines, at least 18 people were confirmed dead after a chunk of glacier dislodged and unleashed a devastating flash flood in India yesterday. Officials say that at least 200 people are accounted for after the glacier broke and swept away a hydroelectric dam, with floods forcing the evacuation of villages downstream. Hundreds of military personnel were deployed in the Indian Himalayas today to help in the rescue mission. Police used water cannon today on anti-coup protesters in Myanmar's capital, Naypyidaw. The water cannon was fired in brief bursts against thousands who had gathered for a third straight day against the military's removal and detention of elected leader Aung San Suu Kyi last week. Police appeared to stop using the water cannon after protesters appealed to them, but the demonstration continued. And in sports, Tom Brady won his 7th Super Bowl title after leading the Tampa Bay Buccaneers to a 31-9 victory over the Kansas City Chiefs. At 43 years old, Brady became the oldest player to play in the biggest game in US sport. His previous 6 Super Bowl wins were with the New England Patriots. Now those are our top stories for today. For more news and videos, visit straitstimes.com, and remember to subscribe to our YouTube channel by hitting the red button below. Once again, I'm Haryanto Diman. I'll see you tomorrow for more stories on The Big Story.